my name's Lindsay. I'm going to be your nurse today. Can I please have your name and date of birth?
Hi, Lindsay. I'm Steve Young. I was born September 16th of 1962.
It's nice to meet you, Mr. Young. Can you tell me a little about yourself? What do you do for a living?
I've been working as an accountant and CPA for the same firm for many years.
Do you have a wife and children?
I met my wife Angie in college, and we have 2 kids, Kelsey, who's 7, and Marcus, who's 6. And we're actually expecting another one here in a couple months.
Well, congratulations. I see that you're here today for a follow-up after being discharged from the hospital for chest pain. How have you been feeling since going home?
I've been feeling fine. I'm mostly concerned about what I need to do to prevent another heart attack. I would like to develop a healthier lifestyle. It was really scary having chest pains, and I'd like to prevent that from ever happening again.
Can you tell me what you were experiencing that made you go to the hospital?
Well, I had some chest pain that would come and go. I thought it was indigestion. It got really bad, so my wife took me to the ER.
What did the pain feel like?
It kind of burned at times, and sometimes was sharp.
I know you said the pain would come and go. How long did that last for?
The pain lasted most of the day. Angie brought me to the ER, I'd say, around 3 o'clock in the afternoon.
Were you able to do anything that helped to relieve the pain?
No, that's why we decided to go to the ER.
When you went to the hospital, what did they tell you was wrong?
I was told I suffered a mild heart damage. I was also told that I have a high cholesterol. I need to lose weight. And I need to start exercising regularly. I was really surprised they told me this because I see myself as pretty healthy. I do not see a physician regularly because I feel pretty good.
Have you had any more chest pain since returning home?
No, I think they fixed me up at the hospital.
Had you been stressed or anything before the chest pain started?
I've been really stressed lately. My son was actually in a bad accident. He was hit by a car and hospitalized. He has a cast on his leg and can only get out of bed for short periods of time.
I'm sorry to hear that. Is there anything that you do to help to relieve your stress?
Not really. I usually overeat when I'm stressed.
What types of food do you tend to eat when you're stressed?
I love cheeseburgers from McDonald's with extra fries.
How often are you eating at McDonald's?
At least 5 days a week.
I know you mentioned that you need to start exercising. Do you exercise at all?
I sometimes go for a walk around the block.
How often do you go for a walk?
Maybe once a week. Maybe a little less than that. Ever since my son had that accident.
How about your previous medical history? Do you have any allergies?
Not that I've been told. I do sneeze a lot when I mow the grass.
Have you had any previous surgeries?
Nope.
Have you had any significant illnesses?
Nope.
Do you drink alcohol?
I'm a bit of a social drinker. 2, maybe 3 times a week.
Do you smoke?
Yes.
How much do you smoke a day?
Probably about a pack.
When did you start smoking?
About 15 years ago.
Do you use any illegal substances?
Nope.
Are you up to date on all your immunizations?
Yes. I even get a flu shot on a yearly basis.
When was your last flu shot?
December?
As a child, did you have any major illnesses or surgeries?
No, the only thing I had as a child was chickenpox.
Do you have a family history of coronary artery disease, hypertension, or diabetes?
No, my parents are in great health and I don't have any siblings.
Do you have any hearing problems?
No.
Do you wear glasses or have vision problems? Do you ever have headaches?
Yes. Since college I get some migraines.
Do you take anything for your migraines?
Only over-the-counter pain medication. That usually gets rid of the migraine.
How long do your migraines usually last?
The medicine usually takes care of them, but if not, they can last a couple days.
Do you have any problems with your skin, hair, or nails?
I have flaky skin and I use over-the-counter dandruff shampoo.
Do you ever get short of breath?
Nope.
Before this recent hospital stay, had you ever had problems with your heart?
Nope.
Do you have any problems with movement of your joints? Do you have any problems with your memory?
No.
Do you have any abdominal pain?
Sometimes, but nothing unusual.
When was your last bowel movement?
This morning.
Do you have any problems with urination?
Nope.
Okay, I know I've asked you a lot of questions, but would it be okay if I took your vital signs?
Yeah.
First, I'm going to take your blood pressure, so I'll just have you relax your arm. I'm going to put the blood pressure cuff around your arm, and when I tighten the cuff, you'll feel it squeeze your arm. It won't last very long, so if you could just sit still for me.
Okay.
Okay, 120/76.
Hang on a minute.
No.
Good.
Okay, now I'm going to take your pulse, so I'll just have you sit and relax, and I'll just lightly touch your wrist. Okay, thank you. Now if I could just take your temperature, I'm just going to swipe this thermometer across your forehead. So just sit still for me. Okay. Okay. All right, thank you, Mr. Young. I think I have everything I need. So I'll go get the doctor and we'll be right back in.
Thank you.